Dr. Mahadevan from the University of California, San Francisco. Joining me today is Dr. Tom Ullman from Montefiore. Hi, Tom.
Hey, Uma, how are you?
I'm good.
Great being with you this week. You and I had the opportunity again to really review all of the abstracts, both oral and poster presentations for emerging therapies in the non-biologic space and old therapies as well. And we really learned a lot. And what I'm planning to bring back from the podium to my practice is really a number of different things, but I thought I was terrifically impressed with some data on whether mesalamine was useful or not to continue in patients on biologics. And it turns out it's not. It's almost spit in the ocean. We can very, very safely remove these medicines when our patients start biologics, and it's very durable data. I was also very impressed with really a lack of our ability as physicians to educate all gastroenterologists on different things. I was disappointed to learn that we don't do a great job in our post-sonic era with continuing or getting patients on combination therapy. We don't really do a good job of doing colonoscopies on our patients who've had ileocolonic resections. And those are the two things I'm going to bring back, a knowledge that we can stop our mesalamines and that we really need to do a better job of educating one another and living up to our promise to our patients. What do you take away that you're going to bring from the podium to your practice?
Well, I'm very excited about the JAK inhibitors. On May 30th, the FDA approved tofacitinib for moderate to severe ulcerative colitis. So we can now use 10 milligrams twice a day for 8 weeks for induction. If our patients don't respond, they can get another 8 weeks of 10 milligrams twice a day induction and then maintain on either 5 or 10 milligrams. So that's great news to have something else in our armamentarium. At DDW this year, they presented data that showed that there was a 3-day response, which is fantastic, that patients can start to feel better within 3 days on tofacitinib. They also presented the safety data showing that safety was similar to anti-TNF biologics, with the exception being an increase in shingles or zoster. So what I have been doing is vaccinating my patients over the age of 30 with an inactive shingles vaccine to try to prevent that. There are new JAKs, JAK1, upadacitinib, and filgotinib that are in trials and look promising as well.
Yeah, I was super impressed with all of those data that are emerging on the JAK inhibitors. I thought that was really great. I thought we learned some very interesting things about foods. The FODMAP diet that's been so effective in irritable bowel syndrome seems to have a role in Crohn's disease. That's emerging, as well as some other dietary things. I thought this was a really great DDW, and I'm really looking forward to applying many of the lessons learned here and bringing it back into our practices.
As am I. So that's what we are taking back from podium to practice. Thank you.